Why is it that so many kids today are not able to focus? At what point do we assess that this is something to be concerned about?
Child with handwriting difficulties, you cannot get a child to write better by getting him to write more. You need to work on the pre-writing skills that he's meant to have to be able to write independently. We've seen a surge in the number of kids that are being referred for occupational therapy for social and emotional concerns as well. Babies that were thought of to be excessively colicky also turned out later on to have sensory issues. They don't like messy play, they don't like the toothbrush in the mouth, they won't want to get a haircut, they don't want to wash their hair. These are all signs of tactile defensiveness. If a child says, I do not want to wear my school uniform because the collar irritates me, now that's dysfunction. If there's any sort of sensitivities or defensiveness, you generally will see a cluster of signs and symptoms.
Hey parents, welcome to another episode of the Modern Indian Parent Podcast, a podcast that is redefining parenting in Indian families. Every week, we bring you episodes to help you own your modern parenting choices, even if Nani and Dadi don't agree with them. In this week's episode, we are going to be talking all about occupational therapy. Today, we are joined with Dr. Mahek Uttamchandani, who is a pediatric occupational therapist who has over 2 decades of experience. She is also the director at the Stepping Stones PTC, which is an occupational therapy center. She has been working with kids who have both neurological and developmental challenges, helping them unlock their full potential. In this episode, Dr. Mahek is going to be joining us to really help us parents understand a little bit more about what occupational therapy is, if our kids need it, when do our kids need it, and also to just demystify this idea that therapy is not something we should be scared of, that it's okay if certain kids need therapy, and also to help us understand as parents, what can we start doing at home? If we start noticing certain challenges our kids are facing, certain delays our kids are facing, simple things that we can help them with to make sure that they get over this phase quite easily, safely, securely, so that they can reach their potential. I'm so excited for this episode. Let's welcome Dr. Mahek. Welcome, Dr. Mahek, to the Modern Indian Parent Podcast. How are you doing today?
I'm doing very well, and I want to thank you at the outset for giving me this opportunity to come and answer a few questions. And I'm really excited to be here today.
Yes, Dr. Mahek, this word occupational therapy, I think when a lot of parents hear it, first of all, when we hear the word therapy, we get a bit nervous because we think of a lot of negative connotations around it. And I had actually done occupational therapy for my son in Hong Kong for a few months because I had noticed that he was struggling a little bit with his fine motor skills. Also, his core was quite weak and he also had some gut issues. So the doctor had recommended it. And after you experience it as a parent, you realize, wow, this is really helpful. It's not scary at all. So that's why this episode is really all about bringing light for a lot of parents on what occupational therapy is and really like busting the myths around it, just so that parents really are aware of what it is. So, Doctor, I'd like to start first. If you could just tell us a little bit about your journey and how you got into this field.
Yeah. Okay. So to begin with, because you ask what is occupational therapy, particularly it is a branch of healthcare. And in India, you study occupational therapy in medical schools. In the West, occupational therapy can be studied even after you've taken arts or any other kind of subject. But in this country, it is considered to be a primary healthcare professional. It basically means that you are helping people gain independence in their daily occupation. And for children, their daily occupation is to grow, to play, and to learn. And so if they're having any sort of dysfunction in any of these areas, then they could be recommended to do occupational therapy. And so when I was looking for a graduate program, I wanted to do something related to healthcare, but I did not necessarily want to be a physician or a surgeon. And that's what sort of drew me to occupational therapy, because it's got its medicine and science aspect of it, but it's also got a side where you got to be really creative and playful. And I have this side to me as well. So it's basically combining your knowledge of science and medicine with a lot of art and creativity. And so I was very drawn to occupational therapy. And why pediatric occupational therapy, particularly because with children, their foundation years play such an important role. And there is a very important window period for the development of a lot of skills. And pediatric occupational therapy is one of those branches of healthcare that can help children catch up on their skills, if at all they've missed any, and in a way prevent more complex conditions later on in adolescence and adulthood. And so that's why I was like, okay, if something can be prevented, then we should be doing it pretty soon. And so that's what drew me to doing pediatric occupational therapy. I've been in the field for about over almost 20 years, and I've worked with different clinics, different organizations, and I've trained in multiple techniques in the US and the UK. And currently, I run a Center for Children with Special Needs in Mumbai called Stepping Stones. I'm also impaneled with two neonatal therapy units. One is the Sir H.N. Reliance Foundation Hospital in Mumbai, and the other is the SRCC Children's Hospital. So I also work as a neonatal occupational therapist on the neonatal unit. And so, yeah, that's my journey with OT.
Yeah, and you mentioned that in India that occupational therapy is a foundation course that a lot of doctors have to study. So if it's something that is very necessary and it is a foundation course, why is it that, especially in India, a lot of people still don't know about occupational therapy, or people are just not looking into it? Why do you feel there's a bit of a distance between?
Yeah, I think one of the things that you mentioned earlier, it's the connotation that people have, or the association that, the negative association rather, that people have with the word therapy. And the other thing is to do with their children. People look at their children as an extension of themselves. And it's very hard for parents to sort of accept that something could be possibly wrong with their child. And so that's why it's something that's not readily discussed. It's not something that people want to openly talk about. And also the idea of occupational therapy that promotes independence is fairly a Western idea, because in the West, people promote independence. Whereas in India, we have the nanny culture, the Didi culture, or you have the grandparents, you have extended family that steps in to do things for your child if he's having a hard time doing it. But yes, it's gaining momentum. I think the awareness is really increasing, especially in schools, given that we have a lot of IB schools now, and there are a lot of people who are practicing from the West in the country. I think the awareness about the importance of daily occupations of children is becoming more. And yeah, OT is, it's gained momentum over the past few years.
Yeah, and when you were talking about how you got into the field, you also explained a little bit about what occupational therapy is, and I found it such a beautiful statement. So if you could repeat to us again and elaborate a bit on what is occupational therapy.
So occupational therapy, like I said, it is a branch of healthcare that helps you to be completely independent, or at least gain as much independence as possible in your daily occupation. And for adults, it could mean your activities of daily living. It could mean work-related activities. It could mean anything that you need to do. Everything that we do from the time we wake up is an occupation. People think occupation means a job or a role that you have to play at office, but that's not all that is. And for children, occupations, like I said, the basic occupation of a child is to play, to learn, and to grow. And anything that interferes with functioning in these areas independently warrants occupational therapy. So if you're having difficulties learning at school, or if you're having difficulties getting on with peers on the playground or in general, or even having difficulties with your daily routines, like brushing your teeth, combing your hair, eating independently, all of these are your occupations.
Okay. And when it comes to therapy, so now a lot of us as adults also are realizing, just general therapy, that there was always a thing only when there's a problem, then you need to seek therapy. And now the talk, and a lot of us friends have been chatting about it, that you don't need to go to therapy only when there's a problem, but you should even go before the problem arises. Now, when it comes to occupational therapy, the only time I considered it was when my son had reached a situation where I said, wow, he really needs help. He's at the extreme. Nothing's working. And that's when I was suggested to do it. So when it comes to occupational therapy, is it something that all kids should be doing, or is it only when we identify a certain delay or problem?
Yeah. So, yeah, that's a very good question, Sanchita, because I think, like you said, there's been a lot of conversation about occupational therapy in parent groups and everybody sees the benefit of it. But to be very honest, like I said, like any other healthcare profession, you have to be able to identify a crisis, identify a dysfunction, have a definitive diagnosis to work with. But you're absolutely right when you say that you don't have to wait until we see a big problem. But if we start seeing delays, or if we start seeing the child having even mild to moderate difficulties, it is a good time to visit an occupational therapist and maybe get an assessment. And the reason I say this is because, especially in the West, where therapy is sort of paid for by insurance, it's been a long-standing role for therapists to be able to validate the need for occupational therapy. So they have to be able to identify an area of dysfunction. There is no denying the fact that, yes, what we do in occupational therapy is going to help every child. But that can also be gained. Those kind of functional gains can even happen on the playground. I mean, if your child is not somebody who's been identified to have a therapeutic dysfunction, then we in those situations, I just suggest life skills like, gymnastics, swimming, just doing some sort of, physical activity, because all of those will also have similar benefits. But like I said, we have to be able to identify areas of dysfunction, and then we can sort of validate the need for intervention. It's not like, if a child walks in and mom wants to just make him physically more agile, we're going to say, okay, come in for therapy. Because at the end of the day, it is a specialized intervention, and we work in a very systematic format where we will have to build a therapeutic goal. And for that therapeutic goal to be built, we need to have an area of dysfunction. If you don't have dysfunction, then what are we working on? So that is the best way for me to explain this.
Sure. And it's interesting you say that, because I was just chatting with a physiotherapist for our last episode for our podcast. And it was so interesting how she was saying that, first of all, if you have certain milestones that we want our kids to meet, it's important to give them a little bit of time. So for example, a lot of parents panic, oh, my child is not sitting up yet. So then they're like, oh my God. But we know that there's a few months to give them. But what she had also said is it's important to know that, okay, if they're reaching that 3-4 months after they were supposed to sit up or crawl and they haven't, it's important to intervene then as a parent and do different activities to help support them. So I think that's what you're saying as well, that give them that space to do things in daily life. But if you notice it's stretching, then it is a good time to intervene. So I want to ask you, because, okay, we understand what occupational therapy is, but I want to get a little deep into it. What are some common issues that you have seen that people have come to you with? And I know we're going to get into a bit of them in detail, but if you could tell us, what are some concerns that we might need to consider seeking occupational therapy for?
So, for obvious reasons, if your child has any sort of a condition which has been diagnosed, like autism, cerebral palsy, ADHD, conduct disorders, then for obvious reasons, your child needs occupational therapy. But then there is a milder set of signs and symptoms that parents could necessarily look out for, including the independence in daily skills like bathing, eating, playing on the playground, copying from the board, handwriting issues, attention issues, focus concerns. And most recently, we've seen a surge in the number of kids that are being referred for occupational therapy for social and emotional concerns as well. So, as occupational therapists, unlike the physios are more concerned about perhaps, the physical, the gross motor and the fine motor milestones. But as an OT, I'm looking at the child a little bit more holistically, and I'm taking into consideration also the cognitive abilities or the social emotional skills. So if your child is having difficulties with emotionally regulating himself, is excessively sensitive, or on the other hand, does not understand social or emotional cues, then that is a good time for you to see an occupational therapist, to just have him evaluated, just to see what are the skills that are missing. And so, like I said, any interference in any kind of occupation of the child, anything that you feel that, okay, he lacks the necessary skills to be independently performing them, are the kind of kids that come into our clinics.
It's so interesting because I always thought of occupational therapy just as, like, physical delays. But what you're saying is it also can relate to mental. delays in terms of like social skills, kids who are super shy or they can't focus, this is also relevant?
Yes, absolutely. I think we're looking very closely at social development, emotional skills, and social emotional regulation in general. We also do assessment of social skills, how you interact with your peers. Can you stand up for yourself? Are you a bully? Are you being bullied? All of these kind of issues can be addressed at an occupational therapy clinic.
No, that's amazing. And, honestly, now the rise of specialists in the sense to help kids, like, for example, I'm a child nutritionist. I know there's so many sleep consultants, there's
Yeah.
pediatric occupational therapy. Now, a lot of people say that there's a rise of this because there's a rise of issues. But do you feel that is the reason, or do you feel that back in the day, we just kind of, our parents just went with the flow and didn't really identify it? Is it because now as parents we're too overly cautious? How come there's suddenly a rise of, I guess, these issues that need to be solved, or were they always there? What do you feel is happening that this shift has suddenly come into play?
I think that's such an important conversation to have, because quite honestly, like you said, it's just that I think definitely the issues have always been there. But I think we're also dealing with a generation of parents who ask questions, who want to know why we're seeing what we're seeing. And we're also dealing with a generation of parents that are willing to change and work with maybe a slightly different style that may be more conducive to the development of their child. And that definitely brings into question, the fact that we have this population that we're dealing with. These parents want to know more. But having said that, there is also recent documentation. There's a lot of literature that's being published about the detrimental effects of maybe harsh parenting, or, not focusing well enough on the emotional quotient of children, not spending a lot of time trying to foster a conducive emotional environment. And what could be the result of this? We've seen that. So we're sort of doing retrospective studies to see that, okay, why has there been an increase in the rate of addiction? Or why is there an increase in the rate of crime? And when they retrospectively looked at this, they looked at things like adverse childhood experiences. They looked at poor emotional environments that were the reason for this. And that's why these conversations are coming up more. And I think parents want to know what is it that they can do best so that they can foster good social emotional well-being in their children. So definitely it's I think it's a little bit more about awareness. It's also about lifestyle changes, lifestyle modifications. We're seeing more nuclear families. Even in a country like India, you have parents with high profile jobs. They might not necessarily have a lot of time spent with their child. So a lot of changes in the way we've been living. But definitely, I think the fact that so much research is being published, people are becoming more aware and more cognizant, and they want to do better.
Yeah. No, I think that's why even I do what I do. And I just see that so much of even a lot of the struggles we have today as adults in terms of autoimmune conditions, even things like scoliosis and all, they're linking back to the milestones that we skipped as kids, or the fact that we didn't eat ourselves and all of this. So you are totally right about that. And I think today we're lucky that there are people like you who are there to help our kids as well and to help us as parents. So let's get into certain situations that I want to ask you about. So let's talk about newborns. So I know you mentioned you have worked with newborns as well, because one of the biggest struggles parents face is reflux, gas, colic. And I remember a friend of mine here, she told me that, oh, my baby had reflux and I went to an OT and it got so much better after. And I was like so fascinated by this idea. So could you tell us, can OT actually help with certain newborn issues like reflux, colic, gas?
Absolutely. And I think, like I said to you previously, that when I assess a child, or when an occupational therapist is looking at a child, we're looking at the child more holistically. Now, we know that one of the reasons that babies can have reflux or colic is because they still are developing maturity in their gastrointestinal systems and maturity in the bowels as well. And so sometimes, these issues tend to be a little bit more common in some babies than others. As an OT, I would definitely necessarily look at things like position and posture while feeding. We know that gravity is going to assist the content of the stomach to stay in the stomach. So we generally suggest an upright posture. On the neonatal units, if babies are on what we call gavage feeds, so tube feeds, then generally we position them in a left lateral kind of position, because anatomically that's where the stomach would sort of retain the content. And so one of the things that we look at is positioning. The other thing that I would do is I do assessments of the latch. So generally, when I work on the neonatal unit and the baby has been referred to start breastfeeding or even bottle feeding, one of the things we do is assessment of how well the baby latches on to the mother's nipple or to the nipple of the bottle. Because, if the latch is not the best, then there could be a lot of air going in along with the feed. And that could be one of the reasons why the baby is collecting a lot of gas. The age old recommendation of burping or winding a baby right after a meal, that is another thing that should be regularly done. But one of the most important things and it's sort of new to what we do in addition to our regular assessments and practice, is educating parents on responsive caregiving. I think just educating the mom about the subtle cues. For example, the baby is telling you in a lot of ways that I'm hungry, but the baby is also telling you in a lot of ways that I am now done or I am full. And there is a tendency for parents to want to feed more. And I think there is a volume driven culture that tends to happen. Parents want to feed the baby as much as they want, like just get the volume in without realizing that the baby is giving you gentle and subtle cues about, okay, I'm full and I shouldn't be overfed. So overfeeding can also cause a lot of reflux and spit ups. Yeah. So all in all, I think just teaching parents to watch out for the cues along with some of these things can really help reduce colic. And another thing that we do is teaching parents massage and positions for babies to play in. So, for example, playing on the belly or doing a massage in the lower abdomen area. Those kind of things can also help release excessive gas. But one of the things we do know is that babies that were thought of to be excessively colicky also turned out later on to have sensory issues or temperamental issues. So just teaching responsive caregiving to parents is also a big chunk of the work that we're doing right now to help parents with recognizing, when discomfort is coming in and what are the soothing things that I can do to help my baby.
Right. This whole responsive feeding, I mean, we see it with solids as well. Parents are so focused, especially in India, that they have to finish 120 ml of ragi porridge every day, no matter what
That's
happens.
right.
And
Yeah.
the amount of clients that have come to me and told me that their child is averse to the bottle, they hate milk, and they're so nervous that the same thing will happen to food. And it's unfortunately a lot because of the nanny culture, because they're forcing a certain amount. And it's quite sad to see, but at least now parents are being aware and trying to make that change. And so what you're saying also is that responsive feeding is very important, and also just positioning in terms of an occupational therapy standpoint. You help make sure that the positioning is correct to help with all these issues. Yeah. And speaking about sensory processing disorders, now this is a term that has come up a lot now, and we see a lot of kids out there who will not touch food. They will go near the stand and they'll run away. Now, what can you define for us, first of all, what is a sensory processing disorder and why are they on the rise?
Right. So, like I said, sensory processing is a neurological process that's happening in all of us. It's happening in you, it's happening in me, it happens in everybody. It's the process by which we're taking in sensory information, and the brain has the capacity to modulate or filter what's not needed and use what's needed. And then we have outputs. So, outputs in the form of being able to learn, being able to play, being able to respond, being able to feel safe. So, when your sensory systems are having a difficulty, they could either be experiencing the sensation a bit too much or a little bit lesser than normal. So when it is a bit too much, that's when we call it sensory sensitivities. So one of the first instances that you described, that children won't eat or they have fussy eating or they won't play with sand, they don't like messy play, they don't like the toothbrush in the mouth, they won't want to get a haircut, they don't want to wash their hair. These are all signs of tactile defensiveness or tactile sensitivity in general. The question is this on the rise? Perhaps, like I said, it's sort of two things. One is there's definitely more awareness about sensory processing disorders. It was not until the late 1990s that we were actually able to publish research and show that sensory processing dysfunction is a real thing. And so it's a relatively new concept, a relatively new idea. But also, yes, there is a possibility that it is on the rise because children are not typically playing and engaging the way that we were We were roughing it out on the playgrounds a lot more than I think the kids are doing these days. With the advent of the internet and screens, all of this has taken a major hit. So this could be one of the reasons why we're seeing sensory processing dysfunction being a lot more prevalent than it was in the past. Yeah. So that is one aspect of it.
So if someone has a child that is really struggling with this, they really don't want to touch anything and they kind of take a step back, what are the first steps that they can take, or at what point can they see an occupational therapist?
Right. So I always tell parents that we all have sensory preferences, right? Like you and me too. We might not like certain textures. We might not like, maybe a rough piece of clothing, but unless that's making you dysfunctional. So for example, if a child says, I do not want to wear my school uniform because the collar irritates me. Now that's dysfunction because you cannot go to school without your school uniform. You need to be in your school uniform. So understanding when it is just a sensory preference, but understanding when the sensory preference is becoming a total dysfunction or it's interfering with your daily routine is the difference. And when it starts interfering with daily routine, and that could also mean that if meal times are longer, if you are spending 3 hours feeding your child a meal, that's not functional. That's absolute dysfunction. That is something that you have to think about. If your child throws a fit every time he has to brush his teeth, that's dysfunction. That's not normal. I mean, if a child says, I don't want to brush once in a while because he's sleepy, that's different. But if a child every morning is going to have a distress because he's been asked to brush, that's not okay. So learning to identify when is it really making you dysfunctional and is it really making yours and the child's life extremely difficult to maneuver, that's when you go out and you seek professional help. And this is very important. This is another, very important conversation to have because we're getting a lot of parents coming in these days, like you said, because OT's now become the popular thing in parent groups and everyone's like, okay, let's go see an occupational therapist. But I'm like, yeah, but it's okay if it's not coming in the way of what he needs to do on a day-to-day basis, then that's not an issue. But on the other extreme, we've also had families that have come and told me that my child will only eat khakra and, a banana and nothing else. And I think that is dysfunction and how, because as a child nutritionist, I'm sure you'll agree that that is going to cause a lot of nutritional deficiencies and interfere with a lot of other things. And I think that works for immediate intervention.
And when we look at kids who have reached that stage, when we actually look back, and I'm sure when you do assessments as well, a lot of it is very related to the environment we have created as parents. Because a lot of kids who are only eating those 2, 3 foods, it's because they were not exposed to variety from the time they started solids. They weren't exposed to different textures, or when they were showing a bit of preferences, parents kind of gave in and only gave them yogurt then, or only gave them that kakra. So I think one of the big things I have learned from this whole experience as a child nutritionist is to prevent these things from happening. Early exposure is so important. Variety is important, and also being patient with your child, that even if they reject something or they make a face, don't panic. I think as
Yeah.
parents, we love to panic.
Yeah.
If you want to avoid these situations from happening, just start early. I guess we could say that, prevention is definitely much better than having to reverse it. So any tips of that parents can do at home if they have a child who is having some issues with food, with sensory, like touching certain foods, anything they can start at home?
Yeah. So generally with touching the food and having sensory sensitivity when it comes to eating is usually you will see that there is a spillover in other areas as well. So like they want maybe do a messy play at school. They won't want to get haircuts. They won't want to do, brush their teeth, don't like nail cutting, etc. And in general, the number one rule is to first address that tactile sensitivity because there is no concept of desensitization. There are certain approaches that would say, oh, it's okay, let him feel it. But really, honestly, you're putting the child through a lot of distress if you're trying to desensitize. So number one thing I would tell parents is just first of all, be patient, be respectful, because what feels like a normal sensation to you and me might actually feel extremely distressful or even painful sometimes to children who have tactile issues. And all in all, anybody who has tactile sensitivity, one of the core principles of intervention is to use heavy muscle work and deep pressure kind of activities. So things like rolling, animal walks, pushing and pulling of heavy objects, getting them to unload your washing machine, anything that requires heavy muscle work. It is regulatory to the nervous system. And once you're doing activities that regulate the nervous system, you see the sensitivities come down. With food specifically, like you said, we have to be not just patient, but also experimental. And sometimes when we have children who come in for OT for the fussy feeding, we introduce playing with food. Because typically, even in the normal developmental trajectory, you will see that when you leave a baby to self feed, even when they're about a year or 14 months old, they mess it. They don't necessarily eat nicely. They might not even eat, but just allowing them to feel the food, to feel the texture, so that it doesn't feel like something alien in the mouth is very important. We might introduce playing with food, right? So maybe a chapati and a cookie cutter, and we're going to make, cut out shapes. So introducing the idea of first being able to comfortably touch the food is one of the things that you can do. And like we said, that, the process of introducing new foods, which obviously you recommend from a very early age, and experimenting with textures and experimenting with flavor profiles, experimenting with how it's sort of, even the warmth of the food, like warm foods and cold foods and moderately warm food. All of these different experiences have to be gradually introduced to somebody who's had a negative experience to feeding. So yeah, these are some of the ideas that we share with parents when working with fussy eating.
Yeah, and it's so important that you said that if a child is having some sensory concerns and they're feeling a bit uncomfortable, don't just push them into it, and just you have to take a step back and try and warm them up. So even if a child is, for example, putting an avocado in their mouth and they're spitting it out and they don't feel safe, it's not that you just keep doing it, but we have to remember that the mouth is not the only sensory. We have the hands, we have smell. So instead, work on the other ones first. So we do a lot of food play as well. I have so many toddlers that come in and they're like, our kid hates fruits or veggies. So I'm like, okay, take a step back, spend some time outside of meal times, get them to start using their other senses. Because once they start touching, feeling, smelling, hearing the sounds they make, get them to paint with it, then they start feeling safe and to have it there. So I think that is very important for us to remember. I think sometimes we forget that there's other senses and to take a step back and work on that. And I want to ask you, because you were talking about also the daily routine and how things can become a dysfunction. So I have two things that I want to ask, because I know there's a lot of kids who cannot, like they scream or they do not want to wash their hair. So I know you mentioned that if it comes in the way of their daily routine, it could be a dysfunction. So when you have kids who are refusing and screaming to do simple tasks like washing their hair, is that a concern? Is it just normal toddler tantrums? And what can we do about that?
So there's two ways to look at it. One is obviously that yes, it's causing a dysfunction, but as a clinician, what I'm necessarily interested in is, am I seeing a cluster of signs and symptoms? Is washing the hair an isolated sign? Then I have to be a little cautious, because like I said, if there's any sort of sensitivities or defensiveness, you generally will see a cluster of signs and symptoms and not just an isolated symptom. So I think that's the biggest way of differentiating. Is this just a tantrum around a certain thing, or is this related to something bigger? So what we're necessarily looking at as a clinician is for that story. Is there a story? Is there a cluster of signs and symptoms that will help me validate the presence of a diagnosis? And I think generally, because washing the hair can be a really tricky one, right? Most kids would not like washing the hair. But if you feel that subtle changes in routine, like, just giving him a preference when it comes to the position in the bathroom. How would you like your head? Would you like it tilted forward? Does it make it easier if I tilt my head backwards? You're getting these fancy little bands these days that prevents the water from trickling onto your face. And if all of these things you've tried and it's worked, then it's probably just been a tantrum around the hair washing. But like I said, if you're seeing dysfunction spill over in other areas, like he won't brush or he won't wear a collared t-shirt, or he likes his tags cut off, or he doesn't like tight elastics, then I know that this is something bigger, and that's something that you necessarily won't be able to take care of alone at home, and that's when you need to see a professional.
Sure, sure. Yeah, because I think that's a great way to distinguish from toddler tantrums to actually a concern that if, okay, they won't wash their hair, but they're not eating and they're upset with certain things. I've seen so many girls, and my daughter also struggles with this when they're wearing clothes. They don't like what they're wearing. It's too tight. It's too loose. So these kind of struggles as well. So you're saying that if you're noticing that along with other things, then you can
That's it.
know that it is something you can seek help for, right?
You need to look for a set or a cluster of signs and symptoms. You're not looking for isolated signs, because even in the clinic, when we're interviewing parents, it is just one single thing. I never generally recommend they come in for therapy. I just send them home with some ideas. But if it's a cluster of symptoms, then we can make a complete diagnostic analysis, and that generally helps.
Got it, got it. Okay, so I want to talk a little bit about another struggle for so many kids in today's world, which is not being able to focus. So many kids cannot sit in one place. If you ask them to do a worksheet or to color or do any arts and crafts, they will sit for 2 minutes, they will get up and they will start running around and they will say, I'm bored, or they just don't want to sit. Now, why is it that so many kids today are not able to focus? And what can we do as parents? Because a lot of times we are told they're kids. They shouldn't be able to sit and focus. So at what point do we assess that this is something to be concerned about?
Yeah. So I think that's a very interesting conversation in itself. And the fact that somebody has already told you that they're kids and they're not supposed to be sitting is also interesting, because generally this is what I say to parents, that it's really your age plus two is the attention span that you should be having. So if you're two, you should ideally have an attention span of 4 minutes and not more. And the reason that we're seeing a lot of difficulties with children trying to sit and focus is because of the changes in the way we're expecting them to learn. We're also, like I said, children are not playing as much, or, we're overly structuring our child's day and packing in so many classes. The children are not really playing the way probably our generation played. And we didn't have classes, and we used to run around in the playground and play imaginary games and climb treetops and do all kind of crazy things. And that was giving us all that sensory input that our brain needed in order to stay regulated for 8 hours in the classroom the next day. But our kids are they have overly structured routines. They have classes back to back. There is absolutely no time for free play. And so I think this is maybe a generational issue that we're seeing again. And the most important of all is the advent of the screens. So even if you're a good cognizant parent and you're not allowing your child to have screen time at home, but unfortunately most schools are using screens now for the educational curriculums. And we know that screens can cause disruption in what is known as the delta waves. And the delta waves are the waves that you need to have a sort of a soft sound mind in order to integrate learning, as well as they play a big role in your sleep cycle. So disruption of all of these things is probably one of the reasons that we're seeing a lot of children with lack of attention and lack of focus. So one of the things that we recommend to parents is that when you're choosing life skills for your child, you have to see what their temperament is. If he is boisterous and he likes a lot of, heavy muscle work kind of games, you got to make selections based on that. If you're sending your child for too many maybe chess classes, coding, where he's again required to sit for too long or look at a screen, I doubt he's going to get that regulatory input that you and me were getting when we were playing on the playground. And I think that's one of the biggest factors to take into consideration when we're talking about lack of focus. And like you said, it might look like every child has difficulty focusing, but when does the child really come in for therapy is, again, when you're seeing that lack of focus across the board, when you're seeing that he can't focus at home, he can't focus at school, he's having a hard time at maybe extracurriculars, that is when, you go in and get professional help, maybe get an assessment and see what might be going on. But if your child, say, is not interested in just one extracurricular that maybe you chose for him, it's just maybe a good time for you to reevaluate and see, is that got something to do with interest? But most often, if a child lacks the skills that he needs to accomplish, say, for example, let's say an academic task, that requires you to have certain perceptual skills or sensory motor skills. And if you lack those skills, you can look like you're distracted because you can't accomplish a task if you don't have the skills. So that's another time when you go into a professional clinic and just have an assessment of the motor skills, sensory motor skills, or perceptual skills, whatever that might be, in order to accomplish that task. So it could be interest, it could be lack of regulation, or it could be lack of the skills that you need to accomplish a particular task.
Yeah, and was watching this Instagram post where there was this Harvard professor, and he said something very beautiful. He said that it's not that our kids can't do something; it's that something is coming in their way. Unfortunately, a lot of times as parents, we find the easy way out because look, we've all done it. I mean, life's tough. We have so much going on. So, if our kid is upset with food, we're like, okay, we're just going to force feed them. We're just going to get the easy way out. But if you actually sit and take a step back and say, but why? Why don't they want to touch the food? What are they feeling? And instead work with them. And that's, I think, where occupational therapy comes in, because we work with the child. That's what you're saying, right? You work with the child to make sure you can get to the root cause and help them, because that is what's going to help them thrive later on in life as well. So I think that is something that has really stuck to me. So whenever I get frustrated with my kids, I'm like, okay, wait, there's a reason. It's okay. Let's try and find the root cause. Wouldn't you agree?
That's it. And I think what you're trying to say is that we got to parent from a place of connection and not control. And when that comes in, you're trying to build a story around any particular behavior. Like you rightly said, if you step back and start thinking about why is he not able to do XYZ, then you are thinking from a more analytic point of view. But that also comes from a space of connection. That's because you're empathizing with your child. You're trying to understand what his difficulties are versus using control, because control uses fear, right? Like, I mean, we always say that a child with handwriting difficulties, you cannot get a child to write better by getting him to write more. You need to work on the pre-writing skills that he's meant to have to be able to write independently. And so that basically spills over into all the daily occupations of any child.
Yeah, and another thing you said about the interest is so true, because you might see a child that loves sports and can go hours and hours, but if you ask them to sit and do some math work, they might not have that focus, mainly because it's not that they can't focus, it's an interest thing. And I think as parents in today's generation, we have these expectations of our kids that is not matching to what is actually what they can do or should do. And I think that is also a big concern, that for us, like our expectations are really high and it's not matching really what they should do. And I want to ask about kids who are because I know you spoke about how you help kids who have certain troubles regulating their emotions. So what about kids who you'll see a lot of kids who are very shy, and then you have some kids who just will talk and are very social. So, I mean, a lot of times that we would think that's their personality, or I will say, oh, I was shy as a kid, so that makes sense that my kid is shy as well. So are these things that we need to actually look into?
That's an interesting question you asked there. And I think, like I said, the reason that we see certain behaviors or social emotional behaviors has a lot to do with how safe the child feels. And that sense of safety and security comes from the primary attachment style with the parent. And generally, children with secured attachments tend to be confident, they tend to be very outgoing, to be up for challenges, they make friends easily, they can sustain friendships and all of that. But if a child comes in, again, I have to sort of, what I'm seeing is the behavior that, okay, the child is shy or the child doesn't feel confident. But under the behavior, there could be multiple reasons. There could be sensory motor difficulties. There could be social emotional concerns. There could be some concerns with the parent-child relationship or the parent-child attachment. And so a thorough analysis is, honestly the way ahead. But yes, like I said previously, that we're looking for a cluster of issues. We're not looking for just a personality trait, right? Like you said, some children are just shy, but then they don't struggle in any other area of performance. They don't have any other difficulties. And that is not something that you will go to an occupational therapist for. That's just probably the personality or the temperament. And temperaments are genetic. We don't do much with them. But If you're seeing dysfunction across the board, you're seeing that the shy personality is interfering with the child's ability to make friends, sustain friendships, or if the child's getting easily bullied, or the child won't participate in the school and the playground, then that is a good time to look at why the child is shy or lacks confidence. And like I said, under the tip of that iceberg, there could be multiple layers, and we got to decode that. And getting professional help is the best way to do that.
Right. So it's quite helpful to know how occupational therapy can help in so many ways. So if someone was to come to your clinic and they've noticed this cluster of concerns, what is the process that you normally go through? So I know you've been talking a lot about doing a detailed assessment. So like if they come to you, so what is the process? They'll come, they'll have an assessment with you, and then according to that, you work on a set of exercises that they're going to be coming and doing every day, or what is the general experience?
Right. So typically when a family comes in for an assessment, there are three parts of the assessment. One is the parent interview, where we obviously ask questions related to from the time the mom was pregnant to when this baby was born, about their milestones, about their early days of infancy, right until now. The second part of the assessment is an unstructured observation. So because the most important occupation of a child is play, play is how they learn, play is how they grow, play is how they essentially develop. We do a thorough assessment, an unstructured observation, which is going to be based out of play, but we have certain parameters that we're looking at. And the third way of assessment or evaluation is to run an objective test. So objective tests that we do here at the center are the SOSI, the SIFT. We have a lot of tests for evaluation of behavior, evaluation of handwriting, and these are standardized evaluations. They're like getting a blood work done, right? It is what it is. It's not my perception or the parent's perception. And so objective assessments really tell us that whatever we're talking about in terms of hypothetically building a story around the child or the child's difficulties is correct. And once we analyze all of this data together comprehensively, we set therapeutic goals and objectives. And we use different approaches for intervention. All of these approaches are scientifically backed and evidence-based. And one of the most popular approaches is the sensory integrative approach. This requires specialized training. You train for years and you will get certified in sensory integration. And all I can say is that when you watch a session, it looks like, so it's not a set of exercises. No two children will look like they're doing the same thing. It's done, the basic sense of it is it's done through play. But what we're necessarily also doing is we're intervening at a level where we can work with the dysfunction or the dysfunctional sensory system. And like I said, you're required to have a certain level of training and certification for that. There are other approaches like a neurodevelopmental approach that can be used for children who have postural control issues or physical concerns. That's the approach that we use for developmental delays and cerebral palsy. We've just recently also started using something called as the Solihull approach, which is a framework for understanding child behavior. It's a program which is popularly used in the UK. So that's another approach that we use. And based on our evaluation and based on identification of issues, we might even use a combination of approaches. So it's not a one size fit all kind of package. It's never like two children are doing the same thing. It's highly individualized, and there's a process of therapeutic goal setting, which obviously has to be met. So that's what the entire process of OT will look like.
Okay, amazing. And generally, is it something that is very long term, or is it something that, can, of course, every case must be different, but in general, is this something parents really have to commit for a long period of time, or do you feel that once that focus and attention is there for a short period, you can actually see the results?
Yeah. So again, like I said, this would be highly individualized based on what is the problem with the child. And like I said, comprehensive evaluation that we're doing is helping us to set those timelines and also to set timed and realistic goals for the child and family. But really what we're trying to see is that when that dysfunction starts becoming function, and when we start seeing independence in the areas that the child was initially struggling with, that is a good time to sort of reevaluate the need for therapy. And that's when we sort of also start weaning the child off therapy or might even discharge the child. But like I said, again, it could be short term, it could be long term, but all of that is individualized. It depends on what we've seen in the evaluation and what has come up based on severity, purely based on how severe is the issue.
Okay, got it. So, yes, we're going to actually link all the details below for everyone listening out there who would like to contact Dr. Mahek. And, you are based in Bombay, right?
That's it. We're in Mumbai.
Yes. Okay. So, whoever would like to reach out, we're going to put the details below. And thank you so much, Dr. Mahek, because this has been a very insightful episode, very eye opening. I have learned so much, and I'm sure everyone listening out there will definitely see occupational therapy in a different light, and also to know that it is okay to seek help.
Thank you. And I want to thank Modern Indian Parenting and Sanchita for giving me this opportunity. Like she rightly mentioned, everybody wants to know more about occupational therapy, and I'd love to come on again and answer questions for you guys. Thank you.